My name is Janine El Halou.
And my name is Laura Nunez, and we are genetic counselors at SHIM.
A cancer genetics consultation aims to establish a possible link between a clinical diagnosis and a hereditary cause. It relies on medical history and family history in order to personalize medical care of the patient and their relative.
A genetic test determines whether you carry a hereditary predisposition or a mutation that increases your risk of developing certain types of cancer. Hereditary cancers account for 5 to 15% of all cancer cases.
A genetics consultation is offered in two situations. The first, to offer genetic testing in order to confirm a hereditary cancer predisposition, in which case the patient or their relative has cancer and there is no known family mutation. Ideally, the first person who gets tested is the person who has the most likelihood to carry a mutation. They are called the proband. Afterwards, depending on the results, this individual's relatives can be referred for a genetics consultation.
The second situation is for a predictive genetic test. In this case, we assess your risk relative to a family member who has already been tested and who has the mutation. In both cases, psychological support is offered.
The main objectives of a cancer genetics consultation are to discuss medical and family history of cancer, to review the principles of genetics such as genes, how they are inherited, and the implications of genetic testing, and we explore the decision-making process and answer any questions you may have. Genetic testing is done on a blood sample. It allows us to look for changes in certain genes known to play a role in protecting us from cancer. If this protection is compromised, it increases the risks of developing certain types of cancer.
Is there a cancer gene? The answer is false. If you have a hereditary predisposition to cancer, that means you carry a mutation that increases your risk relative to the general population to develop certain types of cancer.
There is no certainty that you will develop cancer.
If you think that a genetics consultation is appropriate for you, do not hesitate to discuss it with your doctor after gathering the relevant family history information.
We can assess if a genetic test is indicated for you and accompany in your decision-making process.